Okay, let's discuss the bladder channel, the Luo-Connecting vessel system. Pathway, the bladder Luo-Connecting channel separates from the bladder primary channel at bladder 58. It forms a three-dimensional reticular network dividing into multiple branches and sub-branches within the surrounding tissue. Horizontal division run to the exteriorly paired kidney primary channel. According to some schools of thought, they travel as a transverse bladder Luo connecting vessel to the U1 source point, kidney 3. Solinas et al. Describe a longitudinal division following the pathway of the bladder primary channel, reaching the head and penetrating the nose. While this division is not mentioned in the classics, according to Solinas et al., it becomes evident based on the classic descriptions of the pathologies of the Luo connecting vessels. Clinical importance, pathology, excess, obstruction of the nasal passages, clear watery nasal discharge, headaches, back pain. Deficiency, nosebleeds, chronic clear nasal discharge, sinusitis. The bladder primary channel begins at the inner canthus of the eye at Jingming, bladder 1, and ascends along the forehead to the vertex to intersect with GB15, DO24, and DO20. From the vertex, a branch descends to the temples in the region above the ear, intersecting the gallbladder channel at the points GB7, GB8, GB9, GB10, GB11, and GB12. From the vertex, another branch enters the brain, meets the governing channel at DO17, then emerges to descend to the nape of the neck where the channel splits into two branches. The first branch descends along the posterior aspect of the neck, intersecting DO14, DO13, then descends alongside the spine, 1.5 tune lateral to the midline to the lumbar region. Penetrates deep into the interior via the paravertebral muscle to connect with the kidneys and link with the bladder. A sub-branch separates in the lumbar region, descends along the sacrum, crosses the buttock, and descends to the popliteal fossa of the knee at bladder 40. The second branch separates at the nape of the neck and descends to the medial border of the scapula and then parallel to the spine, 3 tune lateral to the midline to the gluteal region. Crosses the buttocks to intersect the GB30, then descends along the posterolateral aspect of the thigh to meet with the previous branch of the channel of the popliteal fossa at bladder 40. This descends through the gastrocnemius muscle, emerges posterior to the lateral malleolus at bladder 60, then follows along the fifth metatarsal bone to terminate at bladder 67 at the lateral side of the tip of the fifth toe, where it meets with the kidney channel.